For years now, New York City Mayor Michael Bloomberg has led efforts to restrict everything from indoor smoking to sugar-filled sodas. Critics call it regulation run amok. This morning, as Rebecca Jarvis reports, the mayor's latest target is hospitals and baby formula. Rebecca, good morning.
And good morning to you, Gail and Charlie. Yes, it is baby formula. The citywide initiative is called Latch On NYC. It's aimed at pushing moms to breastfeed by limiting access to baby formula, and it is only the latest in a series of health initiatives by the mayor.
First, it was trans fats, then smoking, then sugary drinks. Now, New York City Mayor Michael Bloomberg is going after the baby bottle.
But most of the public health officials around the country think that this is a great idea.
Beginning appropriately enough, on Labor Day, 27 out of 40 New York City hospitals will keep infant formula under lock and key, encouraging more moms to breastfeed. Mothers won't be denied formula, but those who want it will have to hear about the benefits of breastfeeding.
So a mother has enough pressure on her just having a new baby and giving birth for the first time. She shouldn't have to worry about explaining her choices to anybody.
The American Academy of Pediatrics recommends that mothers breastfeed exclusively for the first 6 months. In New York, 90% of mothers start out only breastfeeding. But by the time the baby reaches 2 months, that figure drops to 31%.
We encourage breastfeeding, so what we try to do is to educate our parents.
Flushing Hospital Medical Center in Queens is participating in the voluntary Latch On NYC program, part of a nationwide campaign to improve newborn health.
We certainly want what's best for the babies. We want to prevent them from being ill. We want to prevent them from being admitted into the hospital. No one wants their newborn baby to be sick.
In the past, critics have lampooned the mayor's health initiatives, and this time some moms think he's gone too far.
I don't think it should be something that, that is legislated by the government, obviously. The mothers should have that choice.
But Bloomberg says mothers will still have that choice.
If they can do it, that's great, and if they can't, they can't. Our job is we're not making anybody do it, we're suggesting. And the same thing with full sugar drinks.
Under the program, participating hospitals will also enforce the requirement to provide formula for medical reasons only, keep track of the number of bottles used monthly, and stop handing out free formula. And instead of formula ads, many moms will see this, a poster promoting the advantages of breastfeeding.
All of these things add up. Everything helps a little bit.
More initiatives could be coming. Bloomberg told reporters Monday he's always looking for new ways to improve people's health.
And the fact that 8.4 million people in New York City are living 3 years longer, and you don't think that's something to write about, I don't know what else to tell you.
Jeffrey Kluger, science editor of Time magazine, joins us. Also, here's the question. Breastfeeding is good for you?
Absolutely.
Some children may not do it easily.
Definitely.
The mayor says you have a choice.
Right.
He's just pointing out the benefits of breastfeeding. What's the problem?
Well, the problem is that when women have just given birth, they are in a uniquely susceptible, uniquely suggestible and fatigued position. So they don't necessarily know that if formula isn't offered to them that they have the freedom to ask. There's nothing wrong with making the default position breast over formula. When you make the default, the woman must ask rather than the option being offered to her. I think then you add one more hurdle in the difficulty.
So if you said to her, if you said to the new mother, formula is available, if breastfeeding is not for you, you'd be happy.
Yeah, absolutely. I think that makes a real difference. Now look, the difference between this and the soda ban is that in the case of sodas, you're only hurting yourself. In the case of secondhand smoke, in the case of breast over bottle, there's a second person involved, the baby's involved. So it is important for health officials to take a look at this.
But we just heard the mayor say, Jeff, that he's always looking for ways to keep us healthy.
Right.
And some people aren't doing the right job in their own lives in keeping us healthy. So do you think that this is an overreach on his part?
Well, the question always becomes how far have we overreached? Look, we embrace the idea of Food and Drug Administration keeping our foods pure and safe. We embrace the idea that there are electrical standards your house has to meet before someone is allowed to live in it. So for the state to step in and say, these are the guidelines is a very good idea. But to mix my metaphor a little, when the guideline becomes too high a speed bump, I think that's when it becomes intrusive. So this being if this new policy is finessed just slightly, I think it'll be spot on.
New York City, by the way, is not alone in this. You have Massachusetts and Rhode Island both outlying sending new moms home with baby formula. It used to be that they sent new moms home with a little welcome packet. And it's interesting, Jeffrey, because one of the reasons that they say they're doing that is not to promote the commercial interests of the baby formula providers. But then the question becomes, well, you send patients home with Claritin, you send patients home with multiple other drugs.
That's true.
If this is about commercial interests, then shouldn't there be a blanket rule?
Yes, there should. And I think it would be a good idea to look at that in that situation. Certainly doctors as well are no longer allowed to get branded products, branded merchandise to display on their desks in order to influence patients. Again, I think it's especially important here because when you've come out of the hospital, and this is the case with fathers too, but of course they haven't gone through what the mothers have gone through, you're sleep deprived, you're facing this overwhelming new responsibility, you're highly suggestible. If you put a mug in front of a mother and it says Similac or Enfamil or whatever the other manufacturer is, that's probably the brand of formula that woman is going to use for the next 2 years.
And there's two big ones, Enfamil and Similac, which are both made by public companies. It's a small portion of the business that Bristol-Myers Squibb and Abbott Labs do, but still, it's the kind of thing that we will likely be hearing from these companies on. We reached out to them for comment and haven't heard back yet, but it's the kind of thing we will likely hear from them because in a time like this where companies are trying to make more sales, where the consumer has pulled back somewhat, they're going to make the argument that this is a problem for their business and they might even attach it to jobs.
Sure, absolutely, and that's a legitimate concern. But again, I think the issue becomes making it clear to mothers that we are behind whatever choice you make. Right. If the woman feels, though, when she's in the hospital, that there's any judgment attached, that there's the New York Post, now it's a famously provocative newspaper, but the way they framed it is that a woman will get a talking to if she requests formula. Well, that's clearly not going to be the case, but if the woman even feels like there's resistance or judgment associated with her requesting formula, that's a problem, and that's unfair.
Talking to, never good.
Talking to,
Any
never good.
Never good. Thank you, Jeffrey Kluger.
Thank you so much.
Always good to see you.